Welcome to today's special event to recognise and celebrate the achievements of young professionals in the global eye health sector. And we're also launching this year's Eye Health Heroes programme, which is supported by Allergan and AbbVie Company. I'm Peter Holland. I'm Chief Executive of the International Agency for the Prevention of Blindness, IAPB. We're the overarching alliance for the global eye health sector. We've got over 150 members worldwide, drawn from non-governmental organisations, corporate sector, eye health hospitals, academic institutions and professional bodies. The Eye Health Heroes programme recognises and celebrates the achievements of young professionals within the eye health sector. It's a year-long programme. We connect, develop and celebrate outstanding young eye health professionals from across the NGO, corporate, clinical and public policy global eye health community. And today I'm absolutely delighted to be joined by four special guests. Firstly, our recently appointed IAPB President, Caroline Casey. And I'm also delighted to be joined by three of our current Eye Health Heroes to help us launch this year's programme. Firstly, from Singapore, Grace Chu, who's Assistant Manager with the Essilor Vision Foundation. Secondly, from Nepal, Junu Shrestha, who's Research Coordinator, Clinical Optometrist with the Nepalese Association of Optometrists. And Junu's currently studying for the Masters in Health Policy, Planning and Financing at the London School of Hygiene and Tropical Medicine and London School of Economics. And thirdly, from Cameroon, Patrick Ndongmo, who's Technical Advisor with Sightsavers. So I'm going to turn to them briefly and ask each of you in turn to just tell us a little bit about what you're working on at the moment. And Grace, perhaps I could start with you first.
Hi, Peter. Hi, everyone. So currently in Singapore, we are experiencing a lot of restrictions and lockdowns with the current COVID cases. So in terms of Essilor Vision Foundation's events, a lot of it has been paused or at a standstill. But you know, we will not be overcome or stopped by these limitations, but instead we have turned to very innovative ways in terms of outreach and advocacy of eye health. So one of these things, we're actually working with a design team with a group of students to come up with innovative vending machines that's able to dispense reading glasses for migrant workers. So these vending machines will eventually be created and placed in different dormitories of migrant workers so that they will have immediate access to all these reading glasses after the machine is able to test the eyesight. Yeah, so this is one of a very exciting project that we have, and we hope to be able to equip each migrant worker in Singapore a pair of reading glasses. Yeah.
Great, that sounds fantastic. I'm sure we will come and want to ask you more about that in a moment. So brilliant. Junu, perhaps you could tell us about what you're up to.
Hi everyone, I'm Junu. As Peter have already said, that I'm currently studying health policy, planning and financing at London School of Hygiene and Tropical Medicine and London School of Economics and Political Sciences. So talking about my work in the eye health currently, although I'm in London now, I'm helping my team in Nepal, the Nepalese Association of Optometrists, for the policy advocacy by writing some of the eye health convincing notes to the policymakers there. For this, the Eye Health Hero platform has helped me a lot because I have been able to learn the ways of policy advocacy from this platform, which has become more helpful for me to go through the process of policy advocacy at Nepal and at the same time support my team there.
Brilliant. Thanks, Juno. And I know policy and advocacy is something dear to Caroline and my heart in terms of how critical it is in terms of getting commitment to eye health across the board. Patrick, perhaps we could go to you as well.
Thanks very much, Peter. So I am Patrick Ndongmo, as Peter rightly said. Onchocerciasis is technical advisor at Sightsavers. Onchocerciasis is a neglected tropical disease transmitted by black flies, otherwise known as Cymolium species. And this disease is endemic in regions of West, Central, and part of East Africa and in the Americas. And my activity actually is providing support to Sightsavers, providing support to ministries of health of endemic countries on the journey towards onchocerciasis elimination, which is also known as river blindness. And I participate in National Onchocerciasis Elimination Committee meetings where I provide advice on how surveys should go by and how mass drug administration should be conducted in the best of ways. And when COVID hit, we had to develop strategies to go around COVID. And following the WHO guidance on how to restart activities, we developed the risk assessment mitigation action tool, which is a RAMA tool, with which we used to develop SOPs to mitigate COVID and restart MD activities in a safe and best of ways for both the Ministry of Health staff and for the population receiving the intervention. So that's a summary of activities that I provide support for. And yeah, very happy to answer our questions. Thank you.
Brilliant. Patrick, thank you very much. And I mean, obviously tackling those neglected tropical diseases is really critical. And again, and the challenges you talked about in terms of actually having to adapt services during the current pandemic has been something I think that many people across the sector have experienced. So again, much I think to pick up on as well. This is probably a good moment, Caroline, to hand over to you.
To the troublemaker. So I'm Caroline Casey. And for those of you who are vision impaired like I am, I'm registered blind with ocular albinism. I'll briefly describe myself, which is best practice in COVID times. I'm a white woman with very blonde hair because of my albinism, very white skin, and I'm wearing orange earrings and I'm sitting beside a washing machine, which you can't see. I am a troublemaker, an activist. My passion is disability business inclusion, and I'm founder of the Valuable 500, which is the world's biggest CEO community, accelerating disability inclusion through business. And I am most proudly and recently the president of the IAPB, which is phenomenal. And listening to Patrick speaking, you know, I got into the whole world of disability business inclusion through iHealth, through Sightsavers a long, long time ago. So it feels like it's coming full circle. Now, before we begin our conversation, can I just say, guys, this is way too short, because each of you, Juno and Grace and Patrick, like we could have an hour interview with the three of you, because there's so many things that I'm sure Peter and I want to ask. But before we even do that, huge congratulations. You know, seriously, I think we're often always so worried we're not doing enough, and we stop to take a moment to the things that we've all done. And just congratulations for the passion, the work and endless commitment that you bring. So I just wanted to say that we never recognize sometimes ourselves. We're always thinking about what we should do more of. But I wanted to ask Peter about what is an iHealth hero really? And when you launched this program, Peter, first of all, how many iHealth heroes do we have? And what are the special characteristics that you look for an iHealth hero?
Caroline, well, I think in many respects, you've actually already described it. But I mean, there are some things that is absolutely consistent. iHealth heroes are young professionals. They come from all over the world, and indeed, as Juno, Patrick, and Grace have illustrated, they come from all over the world, but they come from all sorts of backgrounds and professions. But obviously work in iHealth. I think the thing for me, having met quite a few iHealth heroes over the past couple of years, that is absolutely, describes them all, is they're all completely inspirational. And we've already heard that from Juno, Patrick, and Grace already, but that's something that absolutely characterizes, I think, every iHealth hero I've met, is their passion, their commitment to iHealth, and to really making change in people's lives and really making a difference. So that's what we're after with the iHealth Heroes scheme. We have 20 to 30 iHealth heroes a year on the program, it's a great opportunity for us at IAPB to connect with people with essentially the future of iHealth, with people who are going to make a difference, not just now, but in the decades to come. So it's been brilliant for us as well.
You mean not like us old codgers? Is that what you're talking about?
Oh, I'm talking about me, of course, yes.
But for me, when I'm just listening to, I guess what I wanted to ask each of you to start, because where did your passion come from? I mean, I'm guessing that you guys could have all done certain things, but Patrick, if I want to come to you first, where did that passion come from? Why did you choose iHealth? Do you have a personal connection to it? Were you just really interested in it? How did you come to where you are?
Thank you very much for that question, Caroline. So what brought me into eye health is onchocerciasis, because this disease, before health interventions came on, was one of the leading causes of blindness in endemic countries. So ivermectin, the drug of choice for its control, was revolutionary in its control. So this drug actually significantly reduced the number of the amount of blindness related to onchocerciasis in endemic countries. So this issue of blindness brought my interest into research in onchocerciasis to know what were its causes, what were its health implications, how economically affected were the people. And blindness is a very serious economical challenge in affected families, because one blind man in a family means another person has to give up his or her life for that person. So those were the reasons that brought me to looking to be part of the research groups, bringing solutions to onchocerciasis, because eliminating onchocerciasis is eliminating another form of preventive blindness. So that's how I find myself in eye health.
And I guess there's nothing, it seems so ludicrous, the idea of preventive blindness and that we can eliminate it and we can eradicate it. And now really is trying to collect this moment of accelerating that change, because why on earth are we living with things that actually could be changed, and to scale that change? And I think that's what's so important about the collective of the Heroes program, is how we reach into each other and support each other in it, which I guess brings me into, with Juno, you were talking about my convincing arguments for policymakers. Well, share a few convincing arguments. I mean, really, how are we still trying to convince people that we can be eradicating preventable blindness? What are some of the barriers for you that you're coming across, or some of the opportunities, or some of the story or language that's landing?
Thank you, Caroline. So coming to the convincing ideas that I have been writing for my team for the policy advocacy back in Nepal are, first of all, the burden of blindness and its impact on the education of the children. Similarly, the income, the earning of the adult people, and then the gender equality things. So until and unless we have an equitable access to eye care, it is not said that we are able to achieve the universal eye health coverage. So the other convincing thing is it's directly related to the lot of sustainable development goals. So to achieve those goals by each country's till 2030, the sustainable development goals, we will not be able to achieve until and unless we have access to eye health. And so investing in eye health is not about the expenditure, it's not about treating the two eyes of the people, but it's about making the whole community enabled to see, enabled to be aware of their health, and making them empowered for their future, for their living. So with this, the main challenge, I think, is in our countries, like the resource poor, low income countries, is the main challenge is the resources. And then the recognition of the eye health professionals, eye health workers in the national health system. Although the eye health has been integrated into the national health system in the policy, so the implementation of this is the major backlog, which is not being implemented, although it has been in policy since many years. So to bring into the policy was a challenge, but now at present, to implement that is another challenge. And for that, convincing the policymakers and bringing a lot of different stakeholders who have different ideas, different perceptions, and a different kind of vested interest, it's very difficult to bring them into the one platform, one table, and then go towards the consensus. That's the great challenge, but I hope we are working for that, and the continuous work will bring some bright future ahead. Thank you.
So I guess one of your key skills is emotional intelligence. It's sort of trying to manage personalities, isn't it? It's about managing people at the end of the day. Always this is about people, isn't it? Getting people to the table. And Grace, from your perspective, so you're approaching it from a completely different angle. How did you get involved in Estée Lauder Foundation? How did you, is this a personal connection for you? Is this something that you've always been involved in, eye health?
I wish it was as such, but I would say iHealth chose me because it was just a job offer that came up.
Okay.
Yeah, but I'm so fortunate and thankful that it chose me because it opened my eyes literally to the world of eye health. And I kind of stumbled upon it, after going for a job and striving for very high, ambitious goals in my career. I stumbled upon it, and I was just finding a stronger purpose out there to help others. And eye health became such an important topic when I came into this line of work. And through this line of work, it was really the stories that I see on the ground that made me feel so much more connected, and it made it so much more authentic and real to our everyday lives. And one of these stories that I always tell people when they ask me how did I stumble upon this was really the story about this 16-year-old boy that I met in Myanmar in one of our events. He was only 16 years old, but his degree was nearly -16 on both eyes. And at that point, we didn't even have the correct degree of glasses to provide to him. So like the minimum we had was like a -12. But the optometrist said, just let him try because he has never worn glasses his whole life. So we were on the rooftop of this coffee factory. It was very isolated, and we were just all there waiting to see his reaction when he put on those glasses. And then we roll up the windows, showing him acres and acres of land. And once I put those glasses on him, he was just speechless for a few seconds. And we were very afraid to see, like, could he really see well? But when after a few seconds, we look at his face and one tear came down rolling his eye. And before I knew it, I was crying as well. So it's really heartfelt stories like this that really push me deeper into eye health and really wanting to help each and every person have good vision. Yeah. So that was really a true testament to why I'm still in this industry today and why I will still be in this industry in the future.
I think it is really emotional, we take for granted our beautiful eyes, and I remember the first time I saw somebody after a cataract operation in India, and it still sits with me when the bandages were being coming off, Can I ask you all the same question? But just to give it a gut response, and I'm not going to be negative, but I want to know, what do you think is stopping? Because you're the generation that's going to change things, right? You're the generation. So what is it that you want to tell the elders, let's just call them that, the older people, about how we can radically eliminate preventable sight loss? Okay. You've got an audience, you got a statement. What is it that you want to tell us about what we can do? So I'm going to start with Juno, since you are our advocacy expert. You're going to teach us a few lines.
What I want to say is, eye is a sense organ. So without eye, the world is not. So without eye, it's just all the senses that are working. And eye is not a secondary thing, it's the primary. So it enables not only to see the world, to enjoy the beauty of the world, but it enables ourselves to our skill, which we want to do. So as you said, it's not that we should take the eye as granted. It's very important that we now should recognize the importance of eye health and work for the eye health.
And make sure that it's part of all health. Right? It's just of course, it's so obvious, but until we start calling this out, I think people are unaware, right? They really are.
So people then although they know I think they are neglecting this, because eye health is not something related to the death, like the cardiovascular disease, like the diabetes.
But as Patrick says, it's so important to the economy. So like we're not making this connection, right?
Yeah, that's what I'm saying, that even the eye health can cost life of a people. So it affects directly on the road traffic accidents. And then the educational attainment is throughout the whole life of the person. So we should not neglect the eye health. So once we enable children to see better, it is about seeing the whole future better. And it's all about not only the economy of the family or the person itself, but it's all about the economy of the world, of the country. And ultimately, so every part will be developing along with the development of the eye health.
Excellent. Good. Peter, I hope you're writing those down. Right, Grace, you have an audience with all the most powerful older people in the world. What are you going to tell them about eye health?
Okay, let me think. So I think what I really want to tell everyone, that partnerships are really key and vital. Yeah. Collaborations between big organizations, small organizations, even people on the ground is really key to making this work. I think through my many little years of experience, I see things really blossom from, just a very small idea to something that's huge and impactful, just because corporations come together and create and build ecosystem. And I think that is what we should aim for, to be able to build a successful eye health system in the world, is really to create an ecosystem of many different organizations with like-minded beliefs. And I think that will really be key to bringing eye health to the next level. And I'm really looking forward to that. Yeah.
Excellent. Thank you. We couldn't agree with you more. Patrick, you get the last word here. You've got a room full of powerful older people. What are you going to say to them? Come on, you're talking about eradicating stuff. What's your message?
So I'll do it in a two-step way. Now, we have the most powerful people, which are who are aged people. So I'll tell them, please, let's bridge the gap between knowledge and practice. We have the tools, we have the problems, but that link is absent. The link is really absent. We need advocacy systems to bring those together, to link the knowledge to the practice. I'll give an example. Onchocerciasis and even trachoma. You have ivermectin and azithromycin for mass drug administrations. There should be means to fund distribution of these drugs to endemic populations. In the communities, we should be able to tell an aged person, look, if you go blind, what happens? He will say, okay, if I go blind, my son has to take care of me. I'll say, that's good. Your son will have to sacrifice his own future to take care of you. So the economic loss, have you thought about that? So please, if the drug comes, please take these drugs, because you are protecting yourself, you are protecting, you are guaranteeing your children's future. So that's the message I'm going to pass across to people.
Okay, so now I can actually go into the nitty-gritty of it all. So for me, because we are speaking about this program, and I think you are all of you in some way have talked about collaborations and partnerships and the obvious of bringing problems and solutions. So for this Eye Health Heroes program, what do you think has benefited from it? What's your benefit by being part of it? Because I think when I heard you say, Juno, it was brilliant to talk to other people and to learn and to help craft the advocacy piece. What has been the benefit of being part of this program? And I'm going to go to you first, Grace.
So I think for me, apart from hearing from other people, the work that they do around the world, I think what was very insightful were the workshops that were given to us. We were really exposed to a variety of workshops, hearing from leaders from other eye health organizations, or even really skill-based workshops like the elegant, insightful PR workshop that we attended. I think that really impacted me a lot, because it helped in my work of storytelling. In our line of work, the art of storytelling is really key when it comes to allowing the audience, or even people in our company ESSELO, to really understand the work that we do on the ground. And I think the resources that they gave us were really great. I think I really delved a lot into the Pixar website that they shared with us. I thought that was really interesting, and that really helped a lot, especially in our current project of the migrant worker piece, where we had to share this story about the migrant workers being very dependent on their mobile devices as they were confined indoors, and therefore we took this chance to provide for them vision care and eyeglasses. So instead of them coming to us, we came to them, and we needed a lot of people to get on board with the project. And the art of storytelling really helped us share this testimony and this story about different migrant workers which were struggling during this lockdown.
And have you guys met each other before? Have the three of you met online before? Patrick and Grace and Juno, have you met each other already through workshops? Yes or no?
Yes, we've met in virtual workshops with doing our iHeart Inspire events.
Oh, really? Oh, really?
Yeah.
And Patrick, for you, what's been one of the better parts for you of being part of this program?
Yeah, this has given me an opportunity to meet with people from very different backgrounds, but targeting the same objective, preventing avoidable blindness. So it got me I was very touched by this event, because, you know, if you don't meet people like this, you always think that blindness is caused by just a few ailments. But this forum made me learn that there were many sources, and being blind is not a catastrophe. You still can make it. You still have all the potentials you can achieve within being blind or not. Because I was very touched by the Inspire event by the diplomat, His Excellency Webson, from the permanent ambassador of the Antigua to the UN. I think that's it. He's blind, and he could tell us his story, and I discovered that he was very, very influential, not because he's blind, but because of what he has to offer to the population, to the people, to the UN, to the world. So I was really happy and fortunate to be part of this event. Yeah.
I think that's the thing, isn't it? Having the different perspectives, because this is a global crisis, right? And so eye health is different all around the world, and how we have vision is different. I mean, if I had my condition in certain countries in Africa with albinism, I believe, I don't know, Patrick, is this true, but I've read about it, that people with albinism are being accused about spreading COVID, you know, because our skin is so white in countries where your skin is black. So it just really depends. And there isn't one answer to all of this, but there isn't one intention to all of this.
Yes, to all of this.
You know, it's we share the intention and the passion for it, but how we do it is so different. And, you know, for you, what has been the kind of the big win for being part of the program?
I think being Eye Health Hero in 2020 is the big part, because 2020 year is itself a very special year for eye health, because it marks the end of Vision 2020.
Yeah.
So as Grace and Patrick has already said, that it was a great learning platform from people all around the world. And so what I learned from this platform was not only the eye health professionals, optometrists, ophthalmologists, ophthalmic technicians, being an optometrist myself, not only we are working for the eye health, but there are a lot of organizations, a lot of people who work in eye health as their passion, as their career. And it's the right thing that they were the unified approach. They work from all of these sectors will help grow the concern towards eye health more. So yeah, I think I shouldn't say more about the workshop, the Eye Inspire events and the advocacy events, the UN event where the ambassador wept about him. So I think I shouldn't say more about them, because it was a great learning opportunity at the same time. And also not only about the content of the eye health, but the process, how we should go ahead. I learned that as well.
You know, I was just thinking, Peter, could you just jump in here? Do we have a situation where we have like the 2020 Eye Health Heroes? Are we ever looking at them mentoring the even younger generation? Is that something that we've thought about? Because what happens they don't stop being heroes in 2020, right? They're still here. So how do we work with this alum of 2020 into the future? Is there any ideas for that?
So we are beginning to build an alumni network, essentially, because I think that's exactly what we want to do with the iHealth Heroes. Essentially, we've had an iHealth Heroes award for many years, but actually it's only in the past year or so that we've actually recreated the program in this way. So it's a new program, really, for us. We've got a LinkedIn group for them already set up. We're gonna be arranging advocacy sessions, and so to build on the advocacy work, and we want to have continuing network events. I think the idea of potentially mentoring, so linking individuals up with individuals, is a great one as well. I don't think that's something that we had thought of, but I think that's something that it would be great to pick up as well.
Just like a kind of a buddy way, because I think everybody who goes before, you know, it's increasing that sort of circle of influence amongst ourselves, isn't it? So
yeah.
I guess the other question is, so when I started all this work off years ago, sorry, this is the lines on my face, 21 years ago when I was 28, you know, and I think about what's happened in 20 years, and some amazing things have happened. And, you know, you spoke about 2020, and now we're looking 10 years ahead, like in sight. Is it possible to imagine we can eradicate preventable blindness? Is it in sight? So I just want each of you to think, what is the one critical thing that you see, and the role that you can play in being part of this huge ambition that we're all working towards? So what do you want to see, or what do you want to see that you could do in that space? And Juno, I'm going to go to you for that. So you got 10 years. Where do you see your work, or what is the one thing that you want to see happen?
I think after we pass this 2020 Vision 2020, there is still a great challenge ahead, because this has already been predicted that the refractive error, the avoidable blindness, will be increasing, and half the people will be being myopic in 2050. But I see that as a positive aspect as well, because the more the problem, the more the opportunities to prevent, the more the opportunities to treat them. So I see myself as advocating for eye health more in the future. So more specifically towards the integration of the eye health into the health system of the country. And then at the same time, the recognition of the eye health workers and management of the resources which are required for the eye health. And similarly, for the attainment of the sustainable development goals, as said. And I think there is also the chance for clean and green eye care, for as there is the time for climate action. So we are all feeling the heat everywhere.
It's a true integrated approach. So this is the point, is all of these issues can't be separate from each other, right? We have to be mindful of how we look at it in a green way. You're absolutely right. It's well brought up. Grace, from your perspective, you know, I have to ask, there's no way you're getting off this call without me understanding how we're going to scale this vending machine. Why doesn't this happen all around the world? Is this part of something that you want to do? Come on, what in the next 10 years do you see your role, or what do you think is critical? And just do briefly speak about the ability to scale this vending machine idea that was brought on because of COVID, which, go for it.
So I think at the end of the day, what I really would like to do is really to influence others about this eye care message. I think it is really important for more people to know that. And I just hope that at the end of the day, more people will really learn from this message and be really involved in this whole cause. I think this vending machine idea came from us being stuck in our homes and being so limited with the resources that we have. Like going into the dormitories was a big no-no for us. We were so limited in our movement and resources, and we sat there thinking, what else can we do to serve this group of beneficiaries? And then it was so funny, we were just thinking about how our government was actually dispensing masks to us through vending machines, and that idea transformed to, why can't we place vending machines inside the dormitories itself and dispense reading glasses to our migrant workers. And that idea just innovated out of nowhere, and we got more and more partners on board, and we're even in the prototyping process, which is unbelievable when we were talking about pre-COVID, where none of us could have thought of such an idea. So I think at the end of the day, it's really influencing others to join the cause and to show them why is it so important to join this cause of eye health. Because like what I shared, the best service to yourself is really serving others. And we hope that through this cause of eye health, more people will just join us and help to eradicate poor vision.
Because I think, see, this is the point. It's really about intention. And Patrick, I'm going to come to you, because in this, you know, you so aptly said, and here's the problem, and here's the solution, there's a gap in the middle. So you've got the 10 years. I mean, how do you see your role in the next 10 years? And what do you see as being critical in, and, you know, closing this gap? You know, look at what we've just seen. COVID created a situation. There was the intention and desire to bring innovation into space. And then look what happened. That's one small tiny example. What about you? What do you think?
Yeah, I think in the next 10 years, I'll put that in the framework of the WHO 2030 roadmap and into this, where they are honest by saying that it's still going to be challenging to eliminate onchocerciasis from all endemic countries by 2030. It's limited because the journey towards elimination is still very long. There are still tools required for this elimination, and we're working on. And the key thing about is advocacy. And advocacy needs to stop being emotional, because the emotions, I don't think, are still working, still have the effect. Now it has to be more on economic basis, because for elimination, it's not only about partners and stakeholders and international organizations, it's about the government itself. The government needs to push things. An example is, if the government does not, if eye health is not within the health system, it will be difficult to eliminate preventable blindness. Why? Because if the government is not there to push, international organizations don't have the exact information on endemicity of ailments within countries. Only the government has that. And the government is able to give orientation on this is where we need support, this is where we need support. So the government should be able to tell the people, or the government should even understand from international organizations that one blind person is this amount of dollars lost per day. And a prevented blindness case, this is what the government gains. That's an information the government needs to learn and understand. Because if governments know that, I believe it's all about business. If they know that preventing blindness gives them more money, governments are going to sit up. And
do you want a job? Can I recruit you, Patrick, and take you with me around disability inclusion? Because you're so right. Can I just say, because this is exactly what we tried to speak about. Exclusion costs. It costs. And
so much.
You know, and okay, I'm going to push a little bit back about you, because I'd love to hear what both Grace and June have to say. You're so right. We have to have the economic argument, right? But we also need to have the heart argument. Do we not think we need a bit of balance of both, you know? But what's been leading too much is it's the right thing to do, but it needs to be amplified with the cost of this, right?
Yeah.
It really does.
Yeah. It needs to.
Yeah, and I think the amount that we pay to have people dependent, when if you can allow them to see,
make them autonomous,
right? That's the crazy of this one. It's so crazy.
Yeah.
I know we are coming to a point that I now know, Rachel, that we will be launching 2021. But I do want to ask you all a question, right? So kind of like a tweetable moment, if you know what I mean. Something really short and punchy. So we have this campaign going to be coming out called Love My Eyes, or it's like Love Your Eyes, you know, because we need to remember our beautiful eyes, how much we need to be taking responsibility from them wherever they are in the world. And if we all take responsibility from them, how the system can take responsibility for them. So I'm just going to ask you, because why not? You guys are here and you're on the ground, and you could give us something that we could work with. So what way can you love your eyes? So how do you love your eyes? Not only in the work that you do, but you. Because I think, as I say, people take their eyes for granted. They don't think about it. So Peter, I'm coming to you first. What are you going to say about how you love your eyes? And the other three can have a little moment to think of that tweetable line? I love putting people on the spot, and he's going, I can't bear that you've just done that.
I've done that classic thing with Zoom, not unmute myself as well, just to give myself a moment.
You did. That was very clever.
Yeah, no, not really. So I'm not going to give you something tweetable, but actually the thing about it is exactly that I just don't really think. Well, I've actually got amblyopia, so
really?
that's why I wear glasses. So I wore a patch when I was a kid, you know, and I used to go to school in a patch for, I mean, it felt like forever. When I look back at it, it must have been about 6 months probably, if that. But so I guess I have been conscious of it in that way. But particularly in the past year, I've really noticed when staring at screen after screen, really been aware of it. And so actually it's about resting. It's about not staring at the screen all the time, but just taking a break and resting and looking after my eyes is that, and it is for me how I take care of it.
I had a patch as a child, and every time I took it off, I used to remove an eyebrow. I swear to God, I hated it. But I think this issue about COVID, and it kind of relates to what Grace was saying about where the innovation comes from. COVID has made us so much more aware of our eyes, right? So I think that this is the moment that can make the connection around the world to eye health, right? All of our eye health. So, okay, tweetable moments. Who wants to go first? If not, I'm going to pick on you. Who wants to go first? Patrick, I can see you smiling at me. You are going first with your tweetable moment. How do you love your eyes?
I think I love my eyes by keeping them clean. Wash, water, hygiene, sanitation. So that's because that's a serious risk factor for trachoma. So I believe if we love our eyes, we'll practice the wash. And practicing wash is preventing a lot of avoidable blindness.
Oh, you see, that's a skilled response. Well done, you. Yeah. Okay, Grace, how are you going to love your eyes?
So I'm going to love my eyes by closing it every now and then and resting it so that when I open my eyes, the world will be a very beautiful place to see.
Brilliant. Peter, I hope you are taking these. Rachel, are we getting these down? Perfect. Now, last but not least, you know, what about you? How do you want to love your eyes?
I feel I'm very lucky to have a good vision in my eyes. I love my eyes by by visualizing the visually challenged people, by seeing the visually disabled people all around me, and then respecting them, not only respecting them, but also including them and giving them equal opportunity for their development. And then I love my eyes by treating the problems in eyes of other people, like screening the vision of school children before they go to school, loving the eyes of children, loving the eyes of adult, loving the eyes of elderly. So I love my eyes by loving the eyes of others. Thank you.
Beautiful. Thank you. Well, I think for me, I'm going to go with something that Peter says too, is I overuse my eyes and I don't ask for help. And I think that's the thing for me, is that I need some help because my eyes don't work as well as other people do. And that's okay too. And it is about, I'm going to love my eyes by sharing my story, but also asking for help. So I protect them and I rest them. So I think it's a really big deal. We're coming to the end of our conversation. I'm going to ask Peter, does he have a last question before we launch 2021 Eye Health Heroes? I know I overtalk. So Peter, do you have a question you want to ask anybody to finish up?
What are you going to do next?
Okay, guys, what are you going to do next? Who's up first? Grace is smiling. Off you go, Grace. What are you going to do next?
Come up with more innovative ideas to influence, advocate, and impact the lives of others around us. To not be discouraged by whatever that's happening in the world, but continue to be a light in the world that shines brightly for others so that more can see better.
Right. Do you know?
I continue to be working for the policy advocacy momentum in Nepal for the recognition and for the implementation of the stated mentioned policies of eye health. And besides that, I'll also be working for the community and for the school screening campaign, which I have been doing. So I look forward doing those campaigns more extensively in future.
And Patrick, what are you going to do
Yeah.
now?
Yeah, let's try to, as much as possible, to advocate for inclusion of eye health within the health system, because we have a changing demographics. The world population is getting older, and we know that aging is positively related to blindness, and which means things could get worse if strategies don't change. It's very, very important, and I'll really be happy to be an inspiration to others, as you guys are inspirations to us in the eye health field.
Well, I think you already are. I mean, that's why you're here today. And I'm going to do we're going to give you a round of applause but you know, the way the Zoom round of applause is shaking hands, and it's like yeah, well, it's sign language also for applause. So can I just say huge congratulations, and to acknowledge your work on the program for a year, for sharing your stories, because actually your stories are really important. And in a way, what we're trying to do is to get the whole world talking about their eyes. Everybody talking about their eyes, because we all have eyes, whatever way they work, we all have them. And we need to be speaking, we need to be talking, we need to be challenging, we need to be questioning. We can't take it for granted, and it can't be invisible. We cannot be blind, excuse the pun, to these eyes, and the heart and the head argument to them. So congratulations to you, your leaders and your change makers and your innovators. Thank you for your time with us today. And thank you for being here with us as we're going to launch our 2021 campaign to find more of you, as we extend this kind of force for good that nobody can ignore across the world. So Peter, are we ready to launch our 2021 program? Or yes, okay.
Yep, I think we're ready.
We are ready. Okay, so we are now, having seen 3 of our amazing eye health heroes who will be still connected to us through an alumni group, which I believe we are now working on. We don't let you go, but we are absolutely thrilled to announce the launch of our Eye Health Heroes Program 2021. And what's so important when we are asking people to nominate, I don't know how you guys, did you nominate, self-nominate, or were you nominated? But either way, this process is important. We need to hear your voices. We need to hear your different experiences. I think that's what's really come from this conversation today. These are 3 very different lived experiences with very different backgrounds, but combining the intelligence of everybody together and sharing with each other is so important. And whether somebody is a change maker, so somebody who is motivated to make that change happen in whatever field that they want, to just not accept the status quo, not accept that it's simply too hard. You know, we can do hard things. So if you are a change maker who wants to push, or just to be a troublemaker, kind of like me, go for it. If you are an innovator and you've heard Grace speaking about want to keep innovating, coming up with new ideas. So if you've got an idea, or you're starting on an idea within your organization, whatever that organization is, whether it's the private sector or within healthcare or within NGOs, well, nominate yourself or get somebody else to nominate you if you feel too embarrassed. Or if you're a leader in your space, and just be reflective of those people around us who we think should be given a chance to be part of this incredible community with us together. And do know, aside from the fact that it sounds like a very big word, hero, but I started this conversation off with, don't underestimate the power of all of us doing small things. We all don't have to be, Richard Branson or the Secretary General from the UN to make change happen. Not at all. Isn't there that expression, if you want to see how we can make small change happen, be one day in a mosquito, or one mosquito in a room at night, and then you'll know what damage can be done. So, all of us are here to make the change happen. But I think the thing that I've got from all of you is collectively. So being part of this program, you get to be with your peers collectively, to collaborate, We're hearing words about integration and interconnectedness. So to become part of that program, so we really want to invite as many of you as possible. What is core to every hero is the passion, honesty, accountability, intention, and ambition. So we officially, if I could do a drum roll, are launching our 2021 iHealth Heroes program. So officially open, and our official launchees are Patrick, Juno, and Grace. And I want to say a huge, huge thank you to all of you for your time today. Peter, the last words to you, I believe, which is very rare. That'll be very rare that happens.
I'll take advantage of it. Caroline, thank you very much. Thanks for launching this year's iHealth Heroes program. And as Caroline said, there are 3 categories: change makers, innovators, and leaders. And the way to do it is through the nomination form, which you can find on our website, IAPB.org. So if you go online and use the nomination form, that's where you can nominate for the this year's iHealth Heroes Award. So I'd just add my thanks to Caroline, Grace, Patrick, Juno for joining us today. Thanks very much, and look forward to working with you a lot in the future. Thanks very much.